Hi, good evening, everybody, and welcome to our second episode of our telehealth series. My name is Aaqil Khan. I oversee our telehealth operations. I want to quickly thank Community Wellness for putting on these events. They're very informative and educational for the community, and I hope you derive some benefit from it. Now, last month, we highlighted our 24/7 urgent care platform, and that's where you complete the SMART questionnaire and then you send that visit to a provider who reviews it as a separate time. Now, this form of telehealth is known as asynchronous, again, meaning that the provider and the patient engage with the visit at separate times. Today's topic is the other major form of telehealth, which is known as synchronous telehealth. This is real-time audio and or video with one of our KSP clinicians. Now, most of us have actually engaged in this form of care at some point in our life. If you've ever called your doctor's office and received medical advice over the phone, that is a form of synchronous telehealth. Now, not to bore you with the history lesson, but the first phone call ever made was on March 10th, 1876, by Alexander Graham Bell. And the first words that he said were to Mr. Watson, asking him to come see him. And that's because in his excitement, he spilled battery acid all over himself and was seeking medical advice. So that means that the very first phone call ever made was actually telehealth. So we're going to hop over here now to our KSB Hospital website. Now, if you remember, we have our virtual care link here in the right corner. But before going there, I just want to highlight again our KSB COVID Hub. This is your one-stop shop to get all information about COVID and vaccines and testing. So if you ever have questions about COVID, please feel free to visit the hub. It's updated regularly and our marketing team did a great job. But here we go over to our virtual care link. And this is where you can get all your telehealth or, again, telemedicine questions answered. Now, again, last time we talked about KSB Care Anywhere, which is available 24/7. And today we're going to talk about our primary and specialty care visits, which are our synchronous visits. Now, the primary difference between this technology platform and the one we reviewed last month are the hours of service that's available, the appointment types, and how you pay for it. Now, again, KSB Care Anywhere is available 24/7. The main appointment types are your common urgent care issues. Now, because it's on demand, you don't need an appointment. And if you receive a diagnosis from one of our clinicians, you'll be charged $35 via credit card, debit card, or your HSA account. Now, our synchronous telehealth service is available during normal business hours. Now, you can use this service for conditions beyond the common urgent care issues. Our care teams are using this to connect with patients to help them manage chronic conditions such as diabetes or high blood pressure. They're using it as an easier way to have follow-up appointments. And they're also using it to address any urgent care conditions. Now, you do need an appointment to use the synchronous telehealth service. And after completing a scheduled virtual care visit, the visit will be processed through insurance, much like an in-person visit. Our docs and care teams are constantly looking at their schedule ahead of time to determine which visits are appropriate for telehealth. And the members of that care team will reach out to help you get set up. Now, when you are ready for your telehealth visit, you'll be able to come down here and select ready for your scheduled visit. We have links and guides to help you prepare for your visit and how to get started. Now, the main website is ksbhospital.doxy.me. When you come to the website, all you'll do is hit our drop-down menu and select the provider you're here to visit. Okay, once you find the provider you're here to visit, you'll enter the room. And at this point, you'll type in your name and check in. You'll want to be sure to enable your microphone and webcam if you're prompted. You can use your tablet, cell phone, laptop, computer, anything that's connected to the internet. You can use to enter our virtual waiting room over here. Now, once the doctor sees you in the waiting room, they'll start the visit with you. You'll actually even be able to add family members, if you so choose, who can all be in different locations and join the visit together. So at this time, I would just check in. And Dr. Jan is who I'm checking in today, and he's actually available. So he'll see me on his dashboard, and then he'll start the visit with me. And it's that simple. You just log on, check in, and get rolling. Now, in today's socially distanced world, I know many of us are worried to come be seen in person. I can please rest assured knowing that our environmental services team is working around the clock to ensure that our high-touch areas are constantly cleaned. But if you have an upcoming appointment and you're considering canceling because you don't want to come in person, please call your doctor's office and see if your visit reason is appropriate for telehealth. And I want to emphasize that it's very important that you're seen by a medical professional at least once a year. If you have not established with a primary care provider, I urge you to call 1-800-DOCTORS, punch in your zip code, and our team will go ahead and take care of you and get you established. My grandfather always said that your health is your wealth. And I want you to know that our care teams are here for you when you need us, whether it's in person or via virtual care. Thank you and have a good night.